The title of our project is Prevalence of Alcohol and Drug Use in Trauma Activations that Sustained Orthopedic Injuries and Its Effects on Hospital Course. The authors of the study have no conflicts of interest to disclose. Drug and alcohol use have been associated with orthopedic injuries and complications regarding hospital stay and recovery. Several studies have shown that alcohol and illicit drug use predispose patients to orthopedic injuries. However, there have been no studies evaluating toxicology results in orthopedic trauma patients that required a trauma activation upon arrival to the hospital. The purpose of the study is to evaluate the prevalence of alcohol and drug use in patients that required a trauma activation upon arrival to the emergency department and sustained orthopedic injuries. The secondary objective was to assess how illicit substances affected open fractures, hospital stay, and death rates. An IRB-approved retrospective review of the Orthopedic Trauma Registry between 2017 and 2020 identified 745 patients that presented as trauma activations with sustained orthopedic injuries. Blood alcohol levels, urine drug screens, open fractures, length of hospital stay, and death rates were recorded. Patients that screened positive for opioids or benzodiazepines with records of these respective drugs being administered in the field, or had an ongoing prescription, were marked negative for the respective drug screen in our records. BAL screening was considered positive with any detectable alcohol level. Patients that did not undergo a trauma activation with orthopedic injuries were excluded from our dataset. Moving on to the results. 745 patients were identified. 504, or 68% of patients, were screened for alcohol, and 379, or 51% of patients, were screened for drug use. Patients who were tested for blood alcohol levels and urine drug screens on arrival had higher injury severity scores and had prolonged hospital courses compared to patients who were not tested on arrival, with p-value being significant for these variables. Tables 2 and 3 otherwise show that there was no significant difference in age or gender between patients who were screened for alcohol and drug use upon arrival. Of the patients screened for alcohol, 251 patients, or 50%, tested positive. Of the patients screened with urine drug screen, 135 patients, or 36%, were positive. Methamphetamines had the highest prevalence at 54%, followed by cocaine at 48%, then cannabinoids at 12%, benzodiazepines at 3%, opiates at 2%, and methadone at 2% as well, as shown in Table 4. Patients with a positive urine drug screen were more likely to have an open fracture, with the odds ratio of 1.81 and a 95% confidence interval of 1.15 to 2.85. Likewise, patients with a positive cocaine screen were more likely to have an open fracture as well, with an odds ratio of 1.8 and a 95% confidence interval of 1.03 to 3.31. Tables 5 and 6 demonstrate that a positive alcohol screening or a positive drug screening did not have an effect on length of hospital stay or death rates. There's no difference in age or gender between cohorts who tested positive on the alcohol screen when compared to those who tested negative. The same relationship was observed between the cohort who tested positive on their drug screen when compared to their negative counterparts. In conclusion, drug use continues to have a significant burden on healthcare resources and contributes to orthopedic injuries requiring surgical intervention, with alcohol and stimulants being most prevalent in the patient population treated in our institution. We emphasize the utility of a thorough physical exam to prevent missed injuries, such as open fractures, especially in altered or agitated patients. The title of our project is Prevalence of Alcohol and Drug Use in Trauma Activations that Sustained Orthopedic Injuries and Its Effects on Hospital Course. The title of our project is Prevalence of Alcohol and Drug Use in Trauma Activations that Sustained Orthopedic Injuries and Its Effects on Hospital Course. The title of our project is Prevalence of Alcohol and Drug Use in Trauma Activations that Sustained Orthopedic Injuries and Its Effects on Hospital Course.